Madam, in 2012, about 28,000 people in Singapore aged 60 and older had dementia. The Minister estimated that this figure is expected to rise to 80,000 by 2030. Based on projections from the Alzheimer's Disease Association, by 2050 we'll be faced with 187,000 people aged 65 and above who have dementia. We're also starting to see growing numbers of younger dementia patients. In an article last year, Associate Professor Nagendran Kandia at the National Neuroscience Institute estimated that of the 40,000 people with dementia in Singapore, 10% are below the age of 65. The rapid increase in the number of people with dementia is a cause for concern, especially if we do not have enough resources to support them. As such, I would like to ask the Minister for an update on the progress in preparing for the rise in dementia cases. Is it now being done to educate Singaporeans on the risk factors for dementia? There's been an initiative to build dementia-friendly communities in Singapore, piloted at Yishun, Hong Kong, and MacPherson. These communities feature community touch points that act as go-to points for those who have lost their way, and training is provided to persons and businesses within the area so that they may render assistance to persons with dementia. What are the findings of this initiative so far, and how does it compare with plans to address dementia in other countries? Are there plans to roll out this initiative island-wide? And if so, what is the schedule for this? I also like to raise the issue of dementia assessments. Currently, dementia assessments are usually carried out at hospitals and IMH. Will the ministry set a target to eventually have trained staff at all polyclinics to perform the assessment? Thank you.
Professor Fatima Latif and Ms. Ting Pei Ling, as well as Mr. Denise Tan and Ms. Joan Pereira, asked about support for mental health. MOH will further strengthen care in the community over the next 5 years in 5 ways. First, to improve the early identification of mental health symptoms, frontline staff of selected government agencies such as HDB, SPF, NEA, community partners, and social service agencies will receive basic training on mental health conditions. They will be trained to identify and respond to persons with mental health issues in the community, such as referring these persons to AIC for help. We will also continue to create more dementia-friendly communities, where residents, businesses, and other partners are trained to identify and assist seniors with dementia. Second, we will strengthen our response to mental health needs in the community. AIC will act as a first responder to mental health needs identified in the community and coordinate care across the health and social sectors. Community partners and caregivers looking after persons with mental health needs may call the Singapore Silver Line or email for assistance and support. By 2021, we target to respond and support about 1,000 cases a year, up from the current 500. Third, we will expand mental health and dementia services in polyclinics to make care more accessible. Our target is for 1 in 2 polyclinics to implement mental health clinics by 2021. Fourth, MOH and MSL will work together to strengthen integrated health and social care services in the community. AIC will partner and support social service agencies so that they can support clients with stable mental health conditions. We will also expand our network of community outreach teams from the current 18 to 50 by 2021 to educate the public on mental health and reach out to vulnerable and at-risk individuals. MOH will increase the number of allied health community intervention teams from 14 to 18 by fiscal year 2021 to support GPs, community, and grassroots organizations in caring for persons with mental health conditions. Finally, we will strengthen IMH post-discharge aftercare support. MOH will resource IMH to widen their case management support so that more IMH patients will be supported in the post-discharge period and transit well back home. IMH expects to be able to support an additional 3,000 patients over the next 5 years, on top of the current 8,000 patients.